Welcome back to ABC-7 at 4. I'm Mark Ross. August is National Immunization Month, and with school starting and fall just around the corner, now's a good time for you and your family to get those needed vaccines. ABC-7 medical contributor Dr. Ogechika Alozie with Sunset West Health is here to explain it. We're going to stress this a few times during our segment today. Vaccines are safe and effective.
They are. Can't say this enough times. I know there's been a lot of controversy during the COVID period, but vaccines on average are safe. And we're going to talk about some of the details about that, specifically about kids, but also about adults.
All right, so how do vaccines work?
Well, I think one of the things about vaccines is that they prevent millions of deaths around the world, about 2.5 million a year. So when you say, well, how do they work? Typically what happens is that you take a dead bacteria or a dead virus or a piece of it, what's called an antigen, and you introduce it into the body. It can be by a shot, it can be orally, and that sparks your natural or innate immune system to create antibodies. So then what happens, if you ever come in contact with that virus or that bacteria, your body's like, oh, I've seen this before. I know how to do this. Let me go kill it, attack it, and make you less sick.
All right, let's go over the reasons why vaccines are so important.
Well, I think a number of things, right? Again, like you said, we're going to say this again. Vaccines are safe. Harmful diseases that we don't even think about, whether it's cholera or diphtheria, a host of other things that as an ID doctor I see a lot, they haven't been wiped out. And they can come back if there's not enough what's called herd immunity. Enough people don't get these vaccines. So the vaccines protect us from those and outbreaks. We've seen these outbreaks in school settings, kids that are going off to college. We have these painful and very tragic deaths of people that die of meningitis because they weren't vaccinated. And so they can really save your kid's life at any stage.
And it's important to know that vaccines aren't just created and made available. There's a lot of testing done. There's a lot of hurdles to go through.
Absolutely. And I think this is timely because of the international track and field competition that's going on right now. But whether it's preclinical, phase 1, phase 2, phase 3, and finally phase 4, things that my organization is involved in and a host of other organizations in El Paso are involved in to make sure that the vaccine works and is safe. And that's what people should really take home from this.
And you know, they had to go through trials on the COVID vaccine.
Absolutely, multiple.
All right. So let's talk about the vaccine preventable diseases.
Yeah, so I mean, again, you can see this on the screen. I talk about things like MMR for kids, which is measles, mumps, and rubella. We don't talk enough about with kids adenovirus or rotaviruses, things that may not make them severely ill, but can cause diarrhea, can cause respiratory syndromes. And even if they don't make them hospital sick, they can keep them out of school and adults out of work.
And would you look at that? Influenza is one of those vaccines.
It's coming.
It is. Now, I think this one is the most important graphic coming up in today's segment. When should you and your family be immunized, and for what particular diseases?
Yeah, so I think the whole sort of take home with this is there's a schedule. The schedule changes every year to every 2 years. But for your kids especially, the key is this. Talk to your pediatrician. Your pediatrician has this schedule memorized at the back of their hand, whether it's DTaP or polio or pneumococcus or hepatitis A. There's certain vaccines that should be given at certain points in time, and that protects the kids and gives them enough immunity to go through life in school especially.
And of course, vaccines aren't just for children, as we have pointed out here.
Yep, absolutely. And again, we haven't talked about this recently, but even just HPV, right, human papillovirus, that can actually reduce cervical cancer. That's important. Hepatitis B and A for those that are in healthcare settings. And as you just said, although it's 100 degrees half the time, we are coming up on the fall, and that's cough and cold season, specifically influenza.
And adults 65 and over certainly need protection as well.
Yeah, you know, we don't talk about this enough. We focus on pediatric or childhood vaccinations, but as you get older, your immunity starts to go down. And so you need those boosts, right? Whether it's pneumococcal disease, that's a big one that we see in adults. Measles can actually happen in adults as well. And of course, COVID and influenza coming up.
And I see shingles on the list.
Absolutely.
As well as Hep A and Hep B. So plenty of places now where you can get vaccinated.
Yeah, and so this is sort of a no-brainer. Hopefully people know that whether it's a CVS or a Walgreens, some of the local pharmacies, your job, right, depending on where you work, most jobs do provide vaccines at certain points in time. And then urgent cares with public health department. And Immunize El Paso is huge. I will give them a specific shout out because they do an immense job at getting people that don't have access to vaccines across the board.
ABC-7 medical contributor Dr. Ogechika Alozie. Thank you, sir.